about JITO and then pass it on. So, Namo Aryantanam, Namo Siddhanam, Namo Ayriyanam, Namo Uvajayanam, Namo Loye Savasahunam, Eso Panchanamukaro, Sava Pavapanasano, Manglanancha Savesing, Padamamavai Manglam. Thank you. Jai Jinendra and Namaste. Welcome to the webinar, Sound Body, Sound Mind. Just before we enter today's webinar, let me share very briefly about the JITO. JITO stands for Jain International Trade Organization, established 12 years ago in India, over 71 chapters, mostly in India. Internationally, there are 13 chapters established, over 13,000 members worldwide. JITO UK chapter established May 16, and the first event was on 3rd June 2016. We've had 12 events since then. International events with representations from 23 countries. We had 2 of those. In terms of webinars, obviously since COVID, this is the 3rd webinar. The purpose, what's the purpose of JITO? It's a platform for employees, professionals, businesses, and industrialists to learn, share, and network for mutual benefits and beyond. There are 3 main streams: education, economic empowerment, and service. Most of the activity so far in UK has been focusing on economic empowerment. Recently, JITO UK raised over £7,000 and sent to India. It will provide a ration to some 650 families of 4 for 2 weeks. Today's webinar is more about education, and I'm delighted that we have 3 eminent speakers panel for a very current topic. Without further ado, I'll let Nemish introduce the speakers. Nemish is our vice chair. Over to you, Nemish. You're on mute, Nemish. Girish, can you unmute him?
Yeah, I'm just finding him and unmuting him now. You can unmute as well if you find him.
Yeah, sure.
First time I've heard Nemish lost for words. I'm sure he'll be chomping at the bit to come in, won't you, Nemish? Nemish, I could pretend to be you if you want.
Actually, I can't risk that. So, yeah.
Perfect.
Okay, good. Welcome, everybody. Thank you very much for joining us this evening. Today is an interesting topic for JITO. We're about something to do with business or finance and or technology, something like that. But today is just about medicine, and that too, medicine which in a very personal and direct way, which is immediately relevant now. So we have 3 wonderful speakers for you tonight. And we thank all 3 speakers for taking time out to enrich our well-being with your expertise. Okay, so tonight it's a chance for our 3 speakers to become David Attenborough in a way. Okay, so where you take a very difficult and complex subject, and through simplicity and expertise in the subject, you make it engaging and meaningful to the audience, and that's what we're trying to do tonight. So we're really looking forward to that. In fact, I really want to be, much better than the daily briefings that the government give, because they've become very dry and boring. So in that spirit, I think we can retitle the webinar, Stories from the Front Line. Okay, so the people who are going to speak to us are really at the front line, and they're really going to tell us what's going on and how we can look after ourselves. So to introduce them all, first of all, we have Dr. Ameet Bakhai. He's very involved in the community. We all know him quite well. He also is a consultant cardiologist at Barnet General Hospital. and research lead for the Royal Free London NHS Trust. Pretty senior position, and he sees a lot of data about our health, so he's really well placed to see what's going on here. He's been a very active supporter of the Jain community for at least the last 25 to 30 years. And then we have Dr. Arvind Shah, who is a senior consultant pediatrician at the North Middlesex University Hospital Trust, and also the strategic lead for the Royal College of Physicians for South Asia. And that is pretty senior position in advising the Royal College of Physicians. He happens also to be the treasurer for BAPIO. BAPIO is the British Association of Physicians of Indian Origin. So all Indian people and people from Southeast Asia, BAPIO represents them, and he's got some very interesting information about what's happening to people of that group because of COVID. He's also going to talk to us about the schools and the children and the impact that's going to have when the lockdown starts to lift up. And last and definitely, I think the fairest of them all, Professor Rathod is a consultant psychiatrist and director of research at the Southern Health NHS Trust. She also happens to be a visiting professor at the University of Portsmouth and the mental health clinical lead for Wessex Clinical Research Network. So we have people who are brilliant at their field, and they're going to talk to us through stories and examples. So before I get them in and kick off, I thought I'd take 2 minutes just to tell you my experience of COVID, because I think people may share it and it will give us access into how to start the topic. So initially, when it all kicked off, I have to tell you, I thought it was a little bit of a dreamlike existence. We were in a bubble, disconnected from the outside world completely. All the news came through a TV channel, and, you know, was it real, was it not? It was almost like that. On the other side, we had family time. We had children at home from the Easter holidays. We were able to do some activities with them, which we normally wouldn't do, like housework and lots of Netflix, cooking. We gained some weight, and I'm sure many of us did. But then I had a reality shock, and I have to tell you, it was really brought me down to earth, because one of my best friends lost his mother, and we were not able to reach out. We were not able to hold his hand. We were not able to join the prayers. And a week before, she had seemed okay. And then another very close friend lost her father. And at that time, we were able to attend the funeral, and physically 10 people or less in that crematorium with a funeral was, I have to tell you, extremely disturbing, but very, very real of what was going on. And there was no support. There was nothing you could do. You could not go and hug your best friend and say, I'm really sorry, I'm here for you. You couldn't do it. You couldn't hold hands. And so this disease has really taken a big toll in our emotional need to connect and be with each other. So there was that. Then my mother was stuck in a lockdown in India. We wanted to bring her back into London. And, you know, that was a journey fraught with danger, because while she was in lockdown, she was safe. But India was about to lift its lockdown, and we had to bring her out. And she came here on a plane completely packed full of people. 4 days after she arrived, I took her for a swab test, and thankfully the result was negative, and we could relax that she'd managed that journey quite well. And so now we're where we are. We're facing the future. Schools are opening, the lockdown is lifting, and we still have elderly people to protect and to shield. And there will be a lot of us in this situation worrying how to manage all this. And that's really pretty much where we are. I'm sure many in the audience share that. So first, I think let's turn to Dr. Arvind Shah. Arvind Bhai, would you like to kind of maybe come in with your side of the story, maybe relating to children and that kind of area in schools?
Jai Chandra, can you hear me?
Yeah.
Yes.
Jai Chandra, Kiran Bhai and Nimesh Bhai, thank you very much for giving me the opportunity to share my views with JITO community, which is very close to my heart. I'm going to tell you 3 stories which are emotionally quite intense. A story involves me as a parent, The story involved me as a colleague, and story involves me as a pediatrician. When lockdown hit, and I want to just warn you, these are stories where in midst of storm, when we're seeing the high death rates on the daily briefing. When the lockdown happened, the first thing we were told that my hospital will be catering for COVID patients only. I'm a pediatrician. They said the pediatric bed will go to Great Ormond Street, and you have to get heads together, and juniors and yourself be helping and supporting COVID-19 wards and the patients. While this was going on, I get the phone call from my son. He works as junior in Newfield Hospital. He said, Dad, I said, what's up? He said, Dad, I've been asked to volunteer to work in Nightingale Hospital, which was recently built. I said, what's your role? I said, Dad, they'll be ventilating patients and the intensive care nurses will need help rolling over the patients so that you can ventilate their lungs better. My heart was racing. There was shock wave going through my body. I said, really? He said, my friends go, then I will be going. That's my duty. Really, over those 4-week period, I lost my sleep. I was getting nightmares. But the story ended well, all is good. My little second story is about my colleague working in North Middlesex Hospital. She's intensive care sister working mainly in theaters. You probably will know that there were so many intensive care patients getting admitted. We were creating intensive care beds in the hospital to support them, cater for them. And this, my colleague, was actually covering theaters, and she converted her theater beds into intensive care. And she was ventilating patients, and you could see the demand was so much that they were running short of nurses, sisters to look after intensive care patient. So Wilma decided to call her friend, a Filipino friend, just retired, 60 years plus, 65 years plus, bit obese, diabetic. And Wilma's call was responded by her, and she started looking after the COVID patients on intensive care. Unfortunately, she got COVID-19 infection, and story went really wrong, and she got unwell, she got ventilated, and unfortunately she died. And our heart broke, and I want to bring that story to you because at that point, as the BAPIO, the treasurer of BAPIO, we were looking at death rates, and we saw that not only BME, Black, Asian, ethnic minority people, patients were dying, but also healthcare workers were dying. And we wanted to raise our attention to Department of Health. And on 7th of April, we wrote to Simon Tewins. He is the Chief Executive NHS. And then this led into further survey. The survey which we did with 2,000 respondents, we showed that BME was the crucial important factor relating to morbidity and mortality in BME population due to COVID. I'm bringing this to this platform because I want for all the colleagues, JITO colleagues, to be aware of that. If you are in front line, you may be a teacher, maybe a carer, or maybe working as a dietitian, a physiotherapist, it is your right to ask your employer to do risk assessment. There's a risk assessment tool which we work with Department of Health, which is developed, and make sure your risk assessment. We are South Asian, we are a bit obese, and we are a bit diabetic. And I don't want us to get exposed to this virus and have the repeat story. Now, the third story is the story close to my heart as a pediatrician. This is a story of Emma, 10-year-old girl who's having fever for 10 days and looking pale. Parents knew that Emma is not well. Parents wanted to take her to the hospital, but they were worried about she may catch COVID-19. And they delayed and delayed, and eventually she came to the hospital. She was diagnosed to have blood cancer, leukemia. Luckily, all went well. We started on treatment and things. But I want to make one plea to the parents who are on this platform, the JITO parents, our Jain parents, that please, if you have an unwell child, do take them to the hospital, because hospitals are now divided into green and blue, and non-COVID free areas where you can safely take your child. And this is also a message came out from my College of Pediatric and Child Health saying, please, A&Es are running empty. Don't wait for your child to get sick due to non-COVID illness. So may I go further on to my presentation, please? Or should I take a question?
Please go ahead with the presentation.
Arvind Bhai, can I just confirm with you, did you say that the Filipino lady who came to help you, she got COVID and passed away?
Yes.
Wow,
Yes.
that's very sad. I think that was in the news, wasn't it?
Yeah, that was in the news, and it was heartbreaking. And literally, that's what the worry is, that we are calling retired people.
Okay.
More than
Arvind?
65 years old, come back. Yeah. Can you see my slides?
Arvind,
Yeah.
I hope you don't mind. I actually think you should take a few minutes before you go and do the presentation, because this has been a really emotional journey for you. Why don't you let Shanay and I finish our introductions, and then we'll come to your presentation? Would you mind if we did that? Yeah.
Absolutely fine. Absolutely
I think it'll be important, because we just need to continue setting the scene. Yeah. Thanks so much, Arvind.
Thank you. Thank you.
Nemish, over to you.
Okay, so now Amit, so I think while Arvind Bhai just composes himself and takes us through the information about the children as well, Amit, perhaps you can take over, because as a consultant at the hospital, really in the front line, and I know you worked right through the crisis, so you didn't get sick or anything, whereas a lot of your team were off. So I think you've really gone through the brunt of it, and perhaps you can tell us what really went on and how you came out of it.
Thanks so much, Nemish. And Arvind, thank you so much for sharing those difficult stories. I know how difficult that is to share. And you have done that in a beautiful way. This journey that we're taking you through as an audience group is about the difficulties, the challenges, and how we need to come out of this. So if I share with you my own personal story. So my father passed away at the exact end of November. So literally on the 30th of November, he passed away. And I had actually planned in February to take 3 months to go part-time to help my mum recover from this. Now, it was an incredibly joyful ceremony that we actually had to celebrate my father's life. You know, it was a very peaceful way to go. He'd been in the hospital for 2 weeks. He'd had lung disease already himself for 2 years that we'd been managing very well. Everything was controlled. We managed to get him home for the last few days. We were all around with him. We had breakfast with him. He chose when he wanted to pass away. And it was the most joyful way to show graceful transition in life, as we would call it. And that was the backdrop of what I had been facing. You know, we just got together with my mum to support her. Luckily, she's in a house away from me by about half a mile. So she's in a separate house, and I was going to take this time off to go part-time and help my mum. When in fact, all of a sudden, within a couple of weeks of starting that half-time, I needed to come back to work full-time to take charge of not only my department's cardiology manpower that was on the front line, but also to then lead the research efforts at our hospital, Barnet Hospital, for this incredibly nasty disease called COVID-19. Now, what was amazing is that COVID-19 was causing the same lung disease that my father had gradually over years, scarring his lungs, and it was doing it in days. Now, the amount of incredible change and transition we had to go through, the amount of resilience shown by all of the doctors and the nurses and the dietitians and the orthopedic surgeon, the occupational health, the physiotherapists, the pharmacists, you have never seen anything like it. I mean, it was literally a war zone with an organized method of attack to this enemy called COVID-19, this silent viral killer that nobody can see, this invisible thing that's coming along and stealing your breath away. And incredibly, the NHS rose to the best of its ability to meet this. We converted our coronary care unit into a mini ventilator unit called a CPAP unit. The ITU, which normally takes ventilation patients, had to be doubled in size, and it was doubled within 2 or 3 days. We had a whole new ward. Our hospital actually built an entire 30-bedded brand new mini hospital outside within 3 weeks. We set up ways of working that were just not possible in years to come. You would never be able to get 10 different groups, ITU, hospital at night, end of life care teams, dietitians, respiratory colleagues, diabetes colleagues, cardiology colleagues, medicine for the elderly, general medics, pediatricians, all of them all together in one meeting every single day at 12:30, what we call the COVID huddle, to discuss all the difficult patients. For the first time in 15 to 20 years, our morgue was so full we couldn't actually find space for where patients who had passed away could go. ITU turned into such a difficult case. We would normally take patients who are over 80, over 90 very easily onto ITU if they are mobile and if they're able to be self-independent. We know that we can help them get through these situations of heart attacks, heart failure, pneumonias, but COVID-19 attacked the situation so strongly that it was difficult how to allocate our resources. But despite that, the amazing support we got from the management, the amazing support we got from the staff, the porters, the cleaners, every single person, the volunteers, our families, to be able to help us. You know, for 6 weeks, I've never had to pay for lunch, would you believe? Because all lunch and everything else was just put on. You know, we have a coffee lounge in the middle of our hospital run by would you believe, a Virgin Atlantic airplane pilot and stewardesses from the VIP lounge. And we call it the VIP lounge because these guys have supported many of the hospitals to have some small place to have a little bit of rest and respite in the work that we're doing. So shifts, certainly, you know, weekends were just totally out of the window. There was no such thing as a weekend. Every single day was exactly the same. You would spend 16 hours a day in the hospital and not think anything of it. And the only difficulty was when you came home, you had to go straight into a shower. And then how long before you could actually integrate with your family that evening was the difficulties. But, you know, it has been an incredible journey that has polarized two aspects. The best of the NHS has got even better, and some of the difficulties have become even more difficult. You know, and that's happened across the human race. COVID-19 has made resilient people become even more supportive and resilient and helpful. And it has also brought the vulnerable people to light, and they have been challenged. And that is the difficulty of what we need to face. Now, what COVID-19 has done in a unique way is given us three things. It has told us to slow down. It has told us to ask ourselves, what do we value? And it has told us that we have to recognize what it means to be a human being. Nemish has said he had time for cooking and Netflix and being time with family. That's what being human's about. For the first time in my life, I've seen entire families go for walks recently this week as lockdown has lifted a little bit more. And actually just to see the joy of parents and children walking together, just to see the joy of people enjoying cycling, you know, things like that are just astounding. And so it has been a really challenging time. We've had some incredible changes and breakthroughs in research. Now antibody testing has arrived for our staff. So we know what areas we can work in, what dangers we're bringing to each other, what dangers we're bringing to our patients when we go from one patient to another. We've had to work in real PPE protection, personal protection. So we've had to wear different things all day, masks and hats and goggles and all sorts of things like that. We've had to operate under different conditions. But at the end of the day, the virus has challenged us as human beings, and humanity has shown its mettle. And this is where I think these sorts of talks are really incredible, to actually share just how strong we can potentially be. So while I wholeheartedly tell you that Arvind's story we repeated many times every single day, we've had 29-year-olds, fathers of 4, just about to get off the ventilator and dropping dead of a clot in their lungs. We've had all of these difficult things, etc. But at the end of the day, we are here to tell the story. We are here to learn from that story. We are here to make sure that we are prepared for anything that comes down the line. So that's where I'm going to stop my personal story and say, those are the 2 aspects. And I think I'm going to do a little handover through Nemish to Shanay, who I'm really excited to be on the panel with as well. So Nemish, Arvind, Shanaya, thank you very much for allowing me to share that story.
Wonderful. Amit, that's really actually a very uplifting kind of take on the hardship and the stress that you all must have faced, because BBC Two, I think, had a program about the hospital while it was working.
That was our hospital, yeah. That was Royal Free.
That was Royal Free and Barnet, and I had
and our research.
Yeah, and there was so much stress, and yet people were calmly just facing it and going and going and going.
Yeah, I didn't manage to get onto that hospital TV program, but I'm glad I'm on this one. I know if I had a choice, JITO versus BBC, JITO always wins, Nemish.
Yeah, thank you very much. But I think, although you were very positive about it, I think if you can just make one comment before we hand over to Shanaya, is what as a job, you're doing your job, you're looking after people, but in this particular disease, it must have been very difficult to tell patients what the prognosis was, and it must have been very hard to tell the family what you really thought. So how did you all manage that?
So I think one of the most important things is that every single day was different for every single patient. This disease is really nasty. 1 minute you're improving, the next minute you'll go down. And then we have to bring you back up, and whether we can bring you up, whether you stay up. So for example, this is a moving target. The first thing it does is it causes a massive storm and a fire in your lungs. We can support that through oxygen. We can support that through ventilation, but then it causes a massive storm to your immune system so that you can actually get a bacterial pneumonia on top. We can prevent that with antibiotics. Then it causes kidney damage. We can prevent that with a dialysis support. Then it causes cardiac damage. It's actually weakening your right heart. And then we have to give you lots of medications to support your blood pressure. We can overcome that. And then it gives you clots on your lung just as you're about to walk. Now, before that, you're actually lying on your front. Imagine this, Nemish, you're turning over and you're lying on your front for 23 hours a day while you're trying to ventilate. You can't talk to anybody. You barely can see the mobile phone that you want to speak to your family are not around. You can barely see who the doctors are because they're wearing masks. So you don't even recognize, except by voice, that same doctor, the same nurse that's your relationship to life. Okay, so these were really difficult conversations. At every point, if we didn't have this positivity, that patient could actually choose to say, I am just too tired to carry on. I just want to go now. And that was the most difficult time to persuade people, hang on, you're 30 years old, you're 40 years old. You've got a lot of life left in you. You're going to have to fight this with me. We can only do so much, but the rest of that energy comes from you. Now, as to relatives, it's the first time in my life I've had to phone relatives in ward rounds as a routine. At the end of the round, you would phone every single relative because you knew if you didn't phone them, they would call 10 times that day to ask how their loved one is. And so we actually were, the loved ones could not come in. One of my consultants, actually, Rapti Mediwake, actually created a campaign to bring 60 iPads into the hospital to give to the patients and the staff so they could actually FaceTime the patients that had forgotten to bring in any technology or didn't have mobile phones with that technology. There was so much innovation that happened, Nemish. So it was difficult as hell. But on the other hand, that in one way, cardiology prepares you for life and death decisions at all times. You have to be on your top of your game, and you have to know that at any moment, any wrong decision, any slightest change and taking your focus off this situation would potentially result in somebody going away prematurely. So, we didn't have time to really think about ourselves or the potential emotional drain it was causing. It was just every single person needed to have every single ounce of positivity you could possibly give, because this virus demanded the best of you. Yeah, so it was tough.
Yeah, it sounds very tough, because you had long stints and there was no let up within the stints either. So that was amazing. Thank you for that, Amit. Actually, I was going to hand over to Shanaya, but I think Arvind Bhai, do you want to carry on now? Would you be able to present your presentation maybe in about 5 to 10 minutes, and then we can have Professor Shanaya come in and take us through the behavioral side? Arvind Bhai, can you hear me?
Girish, can you unmute Arvind Bhai?
I have.
I can't.
Sorry about that. And my presentation, hopefully. Can you share? Can you see that?
Yeah. Yes.
Okay.
Yes,
Thank
Dr.
you.
Arvind.
Amit Bhai, that was incredible. And I felt I was in the ward with you looking after those patients, and it is intense. This is a tremendous enemy. And the thing is, we have won the storm. And I think it is the time now how we will live with this, because it's not going to go away. And I think we have to learn to live with him at least for 18 to 24 months. And this seminar is so helpful in terms of getting people to gear to this. As far as children are concerned, oops, sorry, yeah. The children get very mild illness, so that's the blessing of this, and I think that is an important message. But the important message more than that is, while coronavirus causes very serious disease in children, if the children get unwell, it is not due to coronavirus, but is due to non-coronavirus illnesses and what Amit calls collateral damage. So if your child is sick and having temperature, if you're worried about how do I take my child to the hospital, it is safe. Safe to take the child to the hospital. And my college has come up with a traffic light scenario to see when you should take the child to the hospital. But the bottom line is, do not sit with if your child is not well, and it is truly safe to take the child to the hospital. The scenario which we have seen in adults, we have seen in very small number of children, what Ameet Bhai was describing, hyperinflation syndrome, but do not worry, it is handful, and I think it is least of an issue. I think it is important that mental health issue is crucial in all this scenario, and it is our duty as parents to tell them in their language about COVID-19. This is a beautiful pictorial from Southampton General Hospital about talking like coronavirus looks like a crown. And it usually causes mild symptoms, a little bit of cold, and that's it. But this does spread, so show them the pictures that you need to protect yourself, you need to wash your hands, and in very small number of children may get unwell. Of course, your daddy and mommy can call 111 to call for your help. And if you need to go to the hospital, they might take a little swab from your nose and the back of the throat. So it shows in that pictorial diagram. And if you end up in the hospital, there may be clown-looking people looking after you, so nothing to worry about. So this is very important to reassure our children, because I'll share that, and I'm sure Shanay will be sharing more about that, but I will touch on that, the mental effect of this virus on children. coronavirus and pregnancy, pregnancy is a high risk factor, but the transmission to the baby is very little. And in fact, we were the first in the world to report the first case of transmission from mother to baby. But baby did very well. Mom was very unwell and luckily got better after about 3 weeks. And all is well. So the transmission is very rare. And I'm not going to talk more about pregnancy and what needs to be done. Child mental health, apologies, Shanay, but I felt I need to mention about this. 60 to 70% of children show anxiety or depression. They're anxious about losing their loved ones, losing their friends, losing their brothers. They're also anxious about something could happen to them. Also, there are issues with socialization and homeschooling. And the important issue, you probably heard on TV with our ex-prime minister is taking over, is safeguarding issue. 1 in 6 children are facing some kind of safeguarding issues like physical or sexual abuse. I don't want to say more about that, but I want to just make you aware. So these are the payoff what the lockdown has done. And it is best that the children should be going back to school, and I'll touch on that. Shielding policies for children are similar to adults, and I'm not going to more in details about that. It's similar to like if they have organ transplant or they had a cancer and think they should be shielded. But the more relevant topic is, should I send my child to the school? And this is the policy from England about it. Clinically extremely vulnerable children, which we call shielding, they should be shielded and stay at home, even if the year group goes back. But other 2 groups of children who are clinically vulnerable, but they are being looked after by GP. If GP is happy, then it is overwhelmingly good for them to go back to school. And the 3rd group is those children who are being under care of secondary care, that is under the hospital, doctors and things. They need to have a conversation with their consultant and make a plan and decide and follow their advice. But in overall, all other children should attend the school when their year group returns. And I mentioned to you about the mental health effect, so it is crucial that they should go back to school. Now, I want to say something a little bit about prevention, which I've not made a slide about, but I think there is very vital that as South Asian community, we should enhance our supplement of vitamin D, which is very crucial for fighting against this disease, more so who are about 60, 65 years of age. It is vital that you improve intake of your vitamin C. And it's also vital that you try and do what Ameet Bhai was talking about, breathing exercise. Very crucial to do deep breathing exercises. I think you'll remember your Ramdev Baba, do those exercises, and meditation is very crucial in terms of getting your body prepared because this virus is going to live with us for a while. Now, I'm part of Jain Doctors and Dentists Association. We had funding through COVID to do free telephone consultation. And Nimish Bhai, if you don't mind, I just want to mention that this is to access to various experts. We have various doctors on our group to help people and support and advise them and signpost them during this difficult time. And this is the email of Jain Network. You can email them. And also we hope to start some educational seminar to living through COVID-19. Nimish Bhai and Kiran Bhai, what you started similar to that, on dental health, mental health, and chronic health disease, pregnancy and surgical issue. And in fact, I'm very proud to announce that next Sunday, my ex-president of Royal College of Pediatric and Child Health, Hilary Cass, is doing keynote speech next Sunday evening from 7 onwards. That's our first pediatric seminar, so please watch out for this space. So thank you very much.
Thank you very much, Arvind Bhai. That was excellent. Can I ask you 2 or 3 points? Okay.
Yes, please. Yes,
first
please.
is you mentioned vitamin D, and then you mentioned vitamin C. I think just to clarify, it's vitamin D that Asians are deficient in, and that's critical right now.
Correct. So
vitamin D,
may I
yeah?
answer that? May I answer that? And maybe Ameet Bhai may be able to highlight. It is vital that most of BMEs, patients and doctors and healthcare workers, are deficient because of our skin pigmentation. It is ideal that you should supplement vitamin D. I'm not saying blanketly, talk to your GP, he might want to do your vitamin D level, but there's no harm in taking the normal dose of vitamin D, because somehow, Amit Bhai, correct me if not, that it will prevent, it will help fight against this disease.
Absolutely.
Because, but you have to take in a reasonable dose to get it absorbed properly. Amit Bhai,
So
correct
one of
me.
the, absolutely right, Arvind. So one of the research, there's a couple of two key points, Nemish, that have come through, as Arvind had mentioned. So vitamin D is an immune booster. So most of us have low levels of vitamin D for two reasons. Number one, we're not exposed to the sun that we would normally be exposed to were we in our original countries, such as India, etc. But number two, we drink a lot of tea. Now, tea actually prevents you being able to absorb nutritious versions of vitamin D and iron. So you can be low on both of those aspects, and it's a diuretic. And so the advice should be that if you're going to drink tea, have it away from your meal should be at 1 to 2 hours after your tea. So you shouldn't have just recently drunk tea and then taking your nutritions. And one of the most key important immune boosting research links that has been made is selenium. Now, selenium deficient patients have had a greater capacity of getting a worse response to COVID-19. Selenium is found in nuts, in cereals, etc. So having a good supply of cereals, nuts, lentils, all of our usual good diet, not actually having a processed diet, is absolutely key to immune boosting ourselves. And then it's also about exercising in adequate amounts to make that absorption of your diet very good, so that there's no excess nutrition. You're not promoting a diabetic-like status. You're not promoting high glucose levels, because those actually weaken your immunity. We'll go into that a little bit more later in detail, but I think that's enough for now, Nemish.
So there was a second point for Arvind Bhai. You recommended that children should attend school for their own well-being, for their mental health, for the social aspects, and also in a way, of course, for safety because of the safeguarding issues. The question people might have is that if you had grandparents looking after children, what is the risk factor to the grandparents who are supposed to be shielded with children attending school?
I think it is very important point, and I think that's where your risk assessment will come. You need to, the individual cases need to be discussed with your GP or your secondary care, to see if it is appropriate to go to the school or not. Now, it is with current state, I don't think you're allowed to be in household with your parents and grandparents. So it may be okay. As the time goes by, things may ease out. And Amit Bhai will probably support me. As the time goes by, the virulence of this virus also goes a little bit down. And the situation may change. But at the moment, household is parents and children. And grandparents are not, unless they're part of the household.
Okay, well, thank you for that. I think the thing is the lifestyle of Indian people and Jewish people. Grandparents are part of the household. So there is a risk factor there. Yeah. Perhaps we can touch on that in the Q&A. So now, Professor Shanay, I think it's time we had you in and understand. In fact, one of the questions that's just come up from somebody who happens to work in A&E at Barnet Hospital is what do you think this first wave has had on the psychology of frontline staff? And I think that ties in very neatly with introducing you in and perhaps listening to your story about your experience.
Thank you, Nemish. Can you hear me okay? Brilliant. As Amit and Arvind, both of you have said quite rightly, this pandemic has presented some really interesting challenges and opportunities for all of us. It's not just in the UK, but across the globe. I'm genuinely grateful for the opportunity to talk to you about some of my observations and feelings in the past few months. And, you know, as we look forward to the next few months, because as you rightly said, we are not through it yet. Now, my personal experience of COVID-19 has been a mixed bag, I must say. You know, same anxieties as everybody else. Particularly my son, who lives and works in London, for us, it was a very big decision as to where he should be. He's home working now, so should we invite him to come and stay with us in the countryside, because, you know, there's much more space and then we can be together. Or do we leave him there, because both of us are healthcare professionals? That was the biggest decision for us, and we kind of gave in to emotions and invited him home. But that also meant living on the edge all the time, because my husband is a GP, so he regularly goes and works in, as they call, the red, green, amber zones, and sees COVID patients, you know, tries to diagnose them, sends them to hospital. So the question very much was, you know, how do we then keep, you know, him slightly separate when he comes home? How long after? Just like you said, Amit, you know, how long after does he integrate with the family? My work pattern changed completely, and so did for all my colleagues in mental health. We went to digital platforms to do phone consultations, video consultations, and, you know, use digital platforms for meetings like everybody else. We became very reliant on technology and had to very quickly adjust to home working. And we could see that my son and I were marking our territories in the house as to who's going to sit in which room to maintain confidentiality. My mom is in India, and there were worries around, you know, how is she going to parents? I'm not sure. You might say, but parents don't really listen to advice. You know, I would keep saying, Mom, you cannot allow servants into the house, please. Can you isolate yourself a little bit? She's 77 plus. But I'm not sure, you know, how much I was being heard. So it was quite a worry, actually, and continues to be honest. My husband had to self-isolate when he developed the symptoms, and that was a very difficult time for us, because not knowing what the outcome is likely to be. You know, if we get it as well, how do we, you know, how do you do complete isolation in the same house? It's very, very difficult. I'm not sure if you've tried it, but it's extremely difficult. So that was a very difficult time, personally for me. But on a humorous note, you know, for the first 3 weeks, we cooked all sorts of lovely stuff. And within 3 weeks, my weight was up by 5 kilos. Oops. So here we are, all on a diet now. Being able to be close to family, you know, our son is at home, which we would have never imagined for the last 2.5 months. It's all three of us are together, you know, priceless, absolutely priceless. Dinner time discussions about the daily COVID, you know, communications and roundups, really interesting. So these times, you know, were possible partly because of COVID and partly because of how it was handled. Now, on a professional front, I must say I've never been busier, and I have been in this profession for 26 years. Seriously, I'm not sure where days and nights merge these days. Amit will tell you. I mean, he rings me early in the morning, and then, you know, a couple of hours later, I tell him, well, you know what, I've just got myself out of bed kicking and screaming, partly because I've been talking to different colleagues across the globe, coordinating research and all in different time zones. I just don't know where time is going. The issue is not just being busy and talking to people, but the issue is also about how we manage people's emotions and anxieties. I have been very lucky to be able to help a lot of people through this journey. Patients, friends, people who are very, very anxious, people who develop post-traumatic kind of symptoms, people who become depressed, so preoccupied by what is going on that they can't even get to the front door. And that's the extent of the psychological trauma that I have seen in the initial days. It has helped me listen and understand some of very unique perspectives on how this pandemic has affected a wide range of people, and every day is different. I mean, I'm seeing things which over 26 years, you kind of think, you know it, you've been there, you've done it, you know it, there's nothing more to learn. And what COVID-19 has shown is that every day is a new day now for me with my patients. I hear things, I hear symptoms, people are having nightmares, people worried about their parents, people worried about their pets, actually. People have horses, etc. What happens if the lockdown does not allow them to go and look after their pets? What happens to their elderly parents who don't want to do online shopping and insist on going into Tesco's? And what if they catch COVID? The kind of worries, it's really heartwarming, really. It has helped me understand different perspectives and the wide range of emotions, even more than I'd ever known. It has been very sad for us because we have lost patients to COVID. We are a mental health and community organization, and my heart does go out to all those people's families who have lost their loved ones. Now, from a mental health, from a severe mental health perspective, it has been particularly difficult because when people are very, very unwell, they need hospitals. And to be able to admit patients to hospitals has been incredibly difficult. How do you keep people safe from COVID when you're trying to treat their severe enduring mental illness? Not sure how many people are aware that we do have the ability to bring people into hospital against their will, because we have powers given to us by the Secretary of State to be able to do that. When you bring people in on sections of the Mental Health Act, because they are so unwell, and God forbid, then if they get COVID, what do you do with that? And it has been incredibly emotive and incredibly difficult managing mental health patients, and we have had patients with COVID. From a research community perspective, as you've already said, Amit, I think the entire research community in the UK has come together, has been trying to work together. The amount of innovation, the collaboration, the team working, it has been absolutely amazing. And just like you said, Amit, I think we have seen the resilience that human beings have brought to COVID to fight this battle. So it has been absolutely amazing. And those are my experiences. And I suppose in the Q&A sessions, it will be really nice to hear some of your experiences, people who are in the audience, as to how you have felt about COVID. Did you want me to do my slides now or later?
Yes, please, Shanay, if you could do them now, that would be great.
Did you-
Just a quick one.
Sure.
I know you're coming at this from the angle of people with mental health issues who may then have an impact from COVID overtaking the hospitals. But COVID itself has caused a lot of stress. So
Yes.
maybe either through your slides or maybe in the Q&A, we could pick up on the behavior that we need, or the mental attitude we need to face the future as we go ahead.
Absolutely.
And
Yeah. Sorry, that's what I hope to cover through the slides.
okay, so why don't you go ahead with the slides?
Okay, Girish, thank you for helping me with those. Obviously, as I already said, people around the globe have experienced different emotions when it comes to COVID. If we go straight to the third slide, Girish, because you've already introduced me really well, Nimish. Brilliant. As I said, people around the globe have experienced COVID. Some have been not so much affected by it, have a quiet family life, they listen to the news, whereas others, their lives have been completely turned around. And it'll be very interesting to hear those stories. So I'm going to talk a little bit about what, Nimish, you are asking me, because each journey has been unique and challenging, and not everybody has mental illness. Girish, will go to the next slide, please. Now, this is a picture from a tweet by a physician, which kind of tries to project how COVID will affect people's psychological health. If you look in the first wave, they are predicting that a lot of effort, energy, and the morbidity and mortality is due to the immediate impact of COVID-19. So you can see someone on a respirator in bed. The second wave is more around the impact of resource restriction, on urgent non-COVID conditions, exactly what you said, Arvind. So there will be a lot of, people who are not getting their chemotherapy, children who are not getting treatment or are not presenting to surgeries or hospitals because they are worried about COVID. The third wave is likely to be the impact of interrupted care on chronic conditions, because people who are mumbled, and then they have, suddenly start to feel more unwell, things open up, and then they are presenting. Now, if you look at the red curve, actually, it's not just fourth wave, because the fourth wave, yes, it is totally about psychological impact of COVID. And purely because when the COVID is more under control, we will be hit by other things like the economic injury, by the burnout in people. When you have such sustained pressured conditions of uncertainty, each and every individual could potentially experience a level of burnout, frustration, anxiety. Exactly what you're asking, I think, Nemish, that it is going to hit all of us in one way or another, because we are only 2 months in. So think 12 months in this situation, that's a sustained period of anxiety, containment, changes in behavior. What is that likely to do? Add to that the economic injury that we are going to look at across the globe, and the loss that we are going to have. So you can imagine how this trajectory, if you think about it, I think the second wave is going to be the psychological impact, and will continue through the third wave into the fourth wave, and is likely to continue. So I don't think we should underestimate what COVID-19 is likely to do to people's emotional health. Girish, can we move the slide, please? So a lot of people have talked to me about stress and anxiety, and this is not patients with pre-existing mental health conditions. This is people who are experiencing it on a day-to-day basis, whether they are healthcare professionals who are worried about themselves, whether this is people, my friends, worried about their families, their own health, etc. Now, of course, stress and anxiety to some extent is completely normal. If we are not anxious, we are not human. It's the normal fight and flight response. But remember that anxiety is on a spectrum, and we are in a very uncertain environment. It's a world destabilizing pandemic. So some anxiety on top of that is again anticipated. Now, some people come to me with minor anxiety around it. It could be in context of, risk of being infected with COVID, but also concerns about what happens about my job. Do I still have job security? So-and-so company is laying off so many people. And some people have anxieties about their holidays. I have booked a holiday in so-and-so time. What's going to happen to that? So anxiety is normal. It can affect our minds, but it also affects our body. Now remember, sustained anxiety has an impact on our immune systems. So what is that going to do to our physical health if for the next 12 to 18 months, we are going to remain in these conditions? Frustration. People feel frustrated in addition to anxiety, especially the young people who are used to partying, clubbing, meeting each other. They have been restricted at home. They're not going to school, online schooling, Zoom parties. It is good, but is it the same? I don't think that's how they would tell you it is. And then anxiety about, as the lockdown is easing, you might think, okay, everything is going back to normal, but is it going back to normal? Actually, it is not. In fact, I'm seeing more anxiety and stress now that the lockdown is opening, purely because people are worried about sending their kids to school. Just like you said, Arvind, what happens if there are grandparents in the house? Shielded individuals are really scared to go out. This pandemic is going to change our behaviors in how we interact with each other. Can you trust that the person who's coming to work with you is going to stand 2 meters apart? It's very, very difficult. Trust me, when I go into work, it's incredibly difficult to stand away from each other. When you are showing something to somebody on your computer, when you're looking at some notes, it's very, very difficult. How do you work 2 meters apart? Instinctively, you go close to people. How do we trust the next person? So our level of trust as human beings, which is so important for our existence, is going to change, which will change our behaviors. It will lead to frustration. It could lead to agitation. It could lead to more anger. and stress in the workplace. And this is something that we need to put in the mix as well. Economic impact, am I going to keep my job? Is my colleague going to keep my job, that I've already talked about? And from an employer perspective, it's really important to understand the anxieties in your workforce, because these anxieties will reduce productivity. Employers, can they actually have safe working? Can they put shields everywhere? Can they keep people apart? Can they make sure that people get their teas and coffees on time? Is everything going to open up the way we are used to it? And what is going to be the sense of achievement that people feel through jobs when we are working in such constrained situations and feeling highly anxious? I'm not sure. So frustration is going to creep in, and people are already beginning to feel that restrictive measures on our lives can leave us feeling quite frustrated, actually, unable to leave the house, see friends, so no socialization when you're even though you're working. And those who continue to work at home, they will continue to feel the frustration because children, they are in school, they are not in school. What happens with your internet, Wi-Fi? You become very reliant on these kind of things. And then for some people, there's going to be loneliness because their children are not visiting, their grandchildren are not visiting. Socialization is quite key to individuals' happiness. So that's going to be affected, and already is actually, nearly 3 months into lockdown, people are beginning to feel the impact of that. Can we move the slide, please, Girish? Now, of course, we need to think about close relationships. Now, I'm sure everybody has these WhatsApp things coming out about husbands and wives being together in lockdown for a very long time. So is it fight or flight? I'll leave that to you to decide. Again, friends and family, is it good or bad being in touch, just through Zoom? How many relationships are going to feel strained during this time? We've already talked about safeguarding issues. We've heard about domestic violence. We've heard about alcohol consumption rising, social distancing, and how do you maintain connections? And I've already talked about trust and fear. Can we move the slide, please, Girish? So that brings us to the question. We could go on and on, we could write a thesis on what COVID-19 does to some people's emotional health, because as we move forward in this journey, more symptoms are going to emerge, more emotions are going to emerge. But what can we do right now? I think it's really important that we manage our mental health in addition to physical health. We see people walking quite a lot. The 1 hour, it has, that restriction is, but yes, we do see people walking a lot, at least once a day. But how much do we do to manage our mental health, our mental resilience? That is key now, because from a mental health perspective, we are in for the long journey. Now, a lot of people wonder about the past. Oh, I wish, I was back to how things were 3 months ago. I wish it was like this. Now, I would ask you a question. Can we go back into the past? The answer is probably no. A lot of people worry about the future. What if I don't have a job? What if I get coronavirus? Well, it's a very real fear, but can you do anything about it? The only thing you can do is here and today. You can be cautious, you can take all appropriate measures, and you can live in the present. But thinking about the past is only going to make us sad. Thinking about the future and worrying about it is only going to make us anxious. So the best you can do is contain your emotions and behaviors and live in the present. These are emotions that we are not always aware of. They just keep coming in a sense. And we think, well, how do I control my emotions? So what I would like to do is, again, before the Q&A section, take a moment and just acknowledge something the pandemic has made you feel, whether it's positive or negative, big or small, an emotion, not behavior, an emotion. What have you felt? Because I think it's really important to look inwards and understand how we are feeling during this time. I believe that through self-reflection, we can understand how our body and mind react to our current, to future, and to past circumstances. And through listening to the reflections of others, we can better connect ourselves to them. Now, I'd like to, yes, Girish, thanks for moving the slide on. So I'd like to tell you something that we have been doing through Southern Health and in partnership with 50 other NHS organizations with universities and charities. And Amit, my new friend, you're very much part of our project, and thank you for helping us with it. We want to actually hear each story and understand each journey that you have had emotionally. We believe that it is only through listening and understanding and attempting to understand we can do the best for our communities and for the people we meet and treat. So I'm going to ask you today to give me 12 to 15 minutes of your precious time to fill out our survey that is trying to evaluate the psychological impact of COVID. Tell us how you have been feeling during this time and how you have been coping. What do we intend to do with it? What we intend to do is, it's a survey that's looking at responses, not just through the UK, but in different countries as well. And what we intend to do is use the information to better prepare ourselves to serve our communities better as organizations. What we intend to do is look at the cultural and political landscapes that have influenced these emotions to be different in different countries and better prepare us for future pandemics and crises. And your responses are incredibly important. We've had this survey live for the past month, and we already have 12,000 plus responses, but I want to achieve 50,000 at least. So your support is really important. Thank you very much.
Thank you very much, Shanay. That was really very enlightening. And I think in explaining the different kinds of problems that people come to you with, a lot of people in the audience will have recognized, issues that they've gone through. So one thing I really felt that early on was a complete sense of like disconnect of what might be physically real as opposed to what was in the house. And then a bit later on, there was a sense when the funerals were happening that there was nothing we could do to help. So, these are feelings of, if you like, not being able to, perhaps maybe it's more men, but certainly it's a lack of control. The healthcare systems were really not helping. They were just sustaining the body while the body tried to fight for itself. So I think there's a lot of those things. But specifically on what you've just explained, do you think that we need to find a way for people to be able to tell their story or to explain their feeling to somebody else just to let it out?
I think the first thing that people need to do is self-reflect and be self-aware of their feelings, because often people carry a lot of emotions without addressing them. And then it almost like boom, by the time I've seen them, it's almost like, oh my God, I can't even get to the door because I'm worried Corona is coming in. And I have to, no, Corona is not coming in. You can't go outside into your garden. You don't want to get to that position because people can, your brain can actually do amazing things to you, because your brain, once it goes into a little frenzy, it keeps controlling how you behave. So the idea is to be very self-aware of your own emotions and what you're feeling, and be able to then articulate it to a trusted friend or a professional, or there are helplines available. People need to be able to trust, somebody, although it could get boring if you talk to everybody about the same thing, but it's useful. What you might find is that other people tell you the same thing, that, oh, you know what, I have the same worries as well, and I had thought it was quite normal considering our circumstances. There's also self-help material available as well. There are some, mindfulness app, there is meditation, yoga, lots of things are available online, and these things, they do help you stay in the present. People want to control because they are fearful. You see, control comes from fear. So the more we are fearful, the more we want to try and take control of the situation. But if we try and understand what we can and cannot control in our lives, it would really help us to moderate our responses. There are some things we just cannot control. So fearing that does not make sense. And that's what they have to train the brain to understand. And those are very simple techniques. There are lots of online resources people can resort to, talking to each other and seeking help.
Okay, thank you for that. So now I think we can have maybe all three of you, Amit, Arvind Bhai, and Shanay, to maybe do a general Q&A. So let me kick you off with one question, because I think it will affect mental health and the body. the mention of vitamin D, Arvind Bhai, seems to have triggered a mini debate on the chat. I know NHS England actually recommend Asians to have vitamin D as a general supplement, but now here what we're saying is that it's needed in a higher level to improve health, and some people are saying that's not proven. So perhaps,
Nemish, do you mind if I jump in here?
Yeah, take it on.
So one of the problems here is that the randomized control trials and research and the way we measure vitamin D is not specific to migrants. It's not specific to Asian migrants. It's not specific to Asian migrants that have remained on an Asian diet or moved to a mixed diet. So I think the data has a lot of holes in it, and I completely appreciate that there's a lot of commercial value in vitamin D supplementation. The first thing to think about is, look, just measure it. If it's really extremely low, then there's no doubt that potentially there's something about your diet that is not allowing you to absorb or retain vitamin D, and you need to sort that out. When you're in the middle range, when you're 40, 50, 60, etc., you know, that's up to you whether you need that supplementation or not, etc. So I think that's going to draw us away slightly from the big issues here about catching infections, getting through infections, worrying about will you end up on ITU? Will you be able to travel? Will you be able to live a normal life? I think the vitamin D supplementation, you know, that's another whole session that we could run on its own, but the data will not allow strong answers. It is contradictory, and we cannot do a countrywide migrant Asians trial. That would just be incredibly large and would require a lot of people to be followed up. So I don't think there's an easy answer to that. If Shanay or Arvind want to spend time on that, that's great, but I think there's much bigger issues to fry here, Nemish.
Okay, so sorry, Arvind Bhai, you wanted to.
I endorse what Ameet Bhai said, and I think it is one which you need to have further research on. I take Ameet Bhai's point. So BAPU recommended to Welsh, and they introduced that policy in Welsh government. But I think the absorption is an issue, what dosage is an issue, but it does have information. But I'm not going to say, because I'm a pediatrician. I'm saying to what I read about and what I'm aware of. I will take Amit's view on board, please.
Yeah. Okay. So moving on to what I think Amit, you rightly say are the burning issues or the key issues. But one practical point, if I can raise, and then you can maybe take it on to the next stage of how people should, you know, carry on. Hospitals seem to be less busy than they were because people are afraid to come in. And
that's a very straightforward one at the moment. Look, right now, 80% of normal work has been suppressed. It's staying at home. People are not actually coming when they should be coming, with heart failure, with cancers, with strokes, with TIAs, with irregular heart rhythms, with, you know, muscles that are not working, nerves that are not working. So there is a general plea here that, yes, of course, we're all going to have to be sensible, but it is not a fear culture that the NHS cannot manage important things like cancer, heart disease, bad lung disease, etc. You need to be coming into hospital, but the key is to communicate with us first, talk to us. Everything is now about able to reach us on the phone or on video conferencing, etc. We can triage you on the phone. We can tell you which site is safe. We can tell you what to do with your headaches, whether to come in or not. We can tell you which scans can be done remotely. We are doing a lot more work remotely, but the point is not to ignore symptoms, because now we're missing heart attacks. We're missing cancers. We're missing things that are easily avoidable and treatable. Right now, our ITU, I have every 4 hours, I can get an update of every single bed I've got in the hospital, whether it's full or not, whether my ITU is full or not. And I can tell you that 80% of our ITU beds are empty. This is a safe time for dangerous things to be dealt with. Do not sit on dangerous things. We've recently managed to get several people through bypass operations, etc. Things are coming back online, but we are also ready for a second wave, okay? And we know 2 waves will come. The COVID second wave will come, but also the normal work that's been suppressed and delayed will also come. Okay, so that's the capacity issue that we're preparing for.
Can I say one point on that, Ameet Bhai?
Please add. Absolutely, mustn't sit.
Nimish Bhai, I think Ameet Bhai, the hospitals are now working in a pattern of COVID and non-COVID. That's how the workforce is going to be. We are working now. And they're working to the extent that the COVID doctors, the nurses, the porters will not cross over to the non-COVID. So suppose I'm on call for, say, COVID ward. After 2 weeks, I have to take a week off and go back to non-COVID. So what I'm trying to reassure that hospitals are thinking deep to avoid cross-infection, cross-contamination. Hence, hospitals are safe places to go back. And as Amit said to me, to avoid further collateral damage, please access hospitals. Yeah, hospitals are really making a lot of effort to make sure the rota. My department rota is changing every so often to accommodate non-COVID rota and COVID rota, and avoid those teams mixing. To the extent that if I'm on sort of COVID-related sort of active work, I'm not allowed to come back to my office. I have to stay in that area. So I'm trying to reassure you guys that the areas, they're making as safe as it could be. And as Shanay said, there's a fear in our mind. I think it's the one which you need to deal with. May I also thank Shanay about answering my question about old people, if you have grandparents, what you should do with the children. I think she's done that. So thank you, Shanay.
So somebody has just posted a question about an eye appointment. So the takeaway is that hospitals are now a very safe place to go to, and people should actually start trying to get seen for any issues they have going on.
But also to call, Nemish. Call. If you're in doubt, please reach out to us. Okay? We can do a lot of phone triaging. We can do a lot of video triaging.
Okay. All right. So, Amit, another question which I have actually from work, because today we did a dry run of how to restart a dental practice. And the question came up of testing for COVID. Now, obviously, there are two kinds of tests. Would you like to just comment as a group on, well, particularly perhaps Shanay, what is the mental thing of knowing a test? Because the tests themselves are actually not conclusive. Am I right? Would you all like to comment?
Shanay, you want to take the mental side of it first before I take anything else?
Do you want to talk about the accuracy of the tests before?
Yeah, sure. So there are two types of tests, Nemish. There are those that we can grow the virus, so there are swabs, and then there are those that are antibody tests. Have you recently come and fought with COVID-19 in your bloodstream? Can we see if you've got IgG levels, which are antibodies to COVID-19? Now, the problem with the swabs is that if it is not capturing enough tissue from the body to be able to grow the virus when we multiply it up, then we may get it wrong and say to you, you haven't got COVID-19, but actually you have. Now, the swabs are particularly helpful for us when we suspect COVID-19, but we don't need the swabs to tell us the story. The chest x-rays, the blood tests, the low lymphocyte count. If I can just share my screen for 10 seconds, I've got just a couple of slides that I just wanted to show you. Girish, can you just let me share my screen for 2 seconds?
Yeah, you can.
Yep, thank you so much. So guys, you can see this on the right-hand side. What I'm going to show you is, this is the sort of x-ray. Can everyone see this x-ray?
Yeah.
Yeah, so on the left-hand side, you've got a properly normal chest x-ray with the heart in the middle and dark lungs. On the right-hand side, you can see this sandblasting of the x-rays. Now, this is the sort of picture that COVID-19 gives you. It attacks the back of the lungs, it attacks the middle of the lungs and the top of the lungs. Now, I'm going to show you here is a CT scan. This is a much more finer x-ray picture. And at the top left, you can see the heart in the middle. You can see those two black holes, which are your airways of your lungs, your bronchi. And then you can see the lung tissue very nicely with the blood vessels going through it. And that's on the left-hand side at the top. On the right-hand side, you can see this sandblasting occurring at the back. You can see the scarring and the tethering. And so that is the sort of picture that COVID-19 will give your lungs, and you have to recover from that. Or you have to be resilient enough to get through that without needing to be ventilated. So that's the sort of picture that I just wanted to take you through. I'll stop the screen share. So The answer to your question, Nemish, is that, most importantly in the risk assessment, most importantly in the dry runs, etc., what you have to be able to recognize is, are you a person that gets over chest infections? Are you a person that gets over viral infections easily? Some of you have asked the question about, is it safe to travel? Well, actually, if you're on a 4-hour plane journey and you are sharing that air with everybody else in that plane, it only takes one person to be particularly ill with COVID-19, and most of you will be exposed to it. And then it'll take about 3 or 4 days before symptoms will occur, and then the swab will be positive, maybe about 2 days after symptoms have arrived. Now, false negative swabs are a hazard. If you are told you haven't got COVID-19, and actually other tests such as x-rays and blood tests say you have, we as clinicians go by the x-rays, your symptoms, and the blood tests rather than the swabs. The antibodies, on the other hand, are 99.5% accurate for the timing of, yes, you've been exposed and it was over a few weeks ago. What they can't tell you is whether you'll get reinfected or not, whether you will become immune compromised and get that same virus coming back and attacking you from your own body, or whether you're a carrier or not. So we can't tell you some of those things. But the antibody test can tell you you've not been exposed in the last few weeks, or yes, you have been exposed and you've got antibodies to it. Hopefully that's the, sorry about the long answer there, Nemish.
No, I mean so it's important to understand the accuracy of this, because people want it for surety, for certainty, but they're not certain things, and there's a timing that's related to them as well.
Absolutely.
Shanay, would you like to say something about the mental aspect of trying to grab hold of that certainty, or whether that is in fact not something to try and find a way around it?
So I think there is a lot of anxiety around it, and a lot of people feel that if they've had a positive test and they've come through it, then that's it for them. Hooray, I've kind of beat COVID-19. I would echo what Ameet has just said, is that we don't know what we don't know. We are living in a very uncertain world with COVID-19. So we know what we know, and we can only go with the evidence that, as Ameet said, this is what we know, that from the last 2-3 weeks, this is what it is suggesting. So if we are trying to, soothe ourselves by saying, well, actually now I've had it, or I have antibodies, now I can get on a plane and travel again, or forget about social distancing, then I think we need to think again as to why we are doing it. What are the reasons why we need to have those behaviors? What are my anxieties? Again, I would come back to that. What am I going to achieve? So as Ameet says, I suppose if you have the symptoms, whether you have a positive test, negative test, most clinicians are saying, well, we consider it as COVID. And that is what I would say to people.
Okay. So it's a little bit of mental strength in the sense of clarity of thinking. But we are living in a world where the medicine is not as sure as it used to be.
Well, medicine is not as sure, but even before COVID, medicine was only 30% sure of what we were doing. You have always this illusion of how much we know as doctors. But if you think about it, there is just so much we don't know as doctors. But of course, the layer of uncertainty that COVID-19 has brought to us is unprecedented. I mean, nobody can even begin to describe how much of this uncertainty. And we as human beings like to be in control. We want to be in control because we want everything our way. If it's not going our way, we start to fear things, we become anxious, and then we put extra controls in it. So we go about, okay, give me a test, give me, can you test my antibodies? Reality is that the evidence is what it is, and we have to be guided by the evidence. So sometimes we have to take a step back from all the fear, the urge to control things, the urge to make everything okay, and just navigate through the uncertainty by living in the moment, by being very aware of what is happening, by holding a level of optimism, by trusting people who are giving us the advice, and trying to be resilient about it while also being compassionate to ourselves and others.
So on that point, it's important, and I think Arvind Bhai mentioned this, that by being kind to yourself means if you feel a symptom, what you are saying is that we should take action immediately. So if it needs hospital, we should go to hospital. rather than sit in and worry for a while until it gets
Yeah.
to the point, right?
Yeah, I wouldn't mind jumping in on that one, Nemish. It's very important that, as Shanaya said, you're in the moment and you make your positive choices, but also you are preparing for the next moment at all times. So, for example, a lot of people I see on the call here may have been shielded, may have been staying indoors. Hopefully, you've used that time to do a lot of stairs and a lot of diaphragmatic exercises to make yourself stronger. At all times, your next moment should be stronger than the moment that left you. If you can not only, it's not just resilience, in the future, maybe sometime later on, it's resilience now. It's resilience for the storm that is always likely to come, but I will always put it behind me. If you do not have that positive attitude, the endorphins in your body go down, the microbiome that is around you and inside your gut, the choices of who you live with, who you love with, who you play with, the choices of what you eat, what you drink, everything goes wrong. Everything slips down the slope. You are not going up and up and up a slope. It is hard to live a positive life. It is hard to have a habit of continuous positivity. But it is only with that habit that we can enjoy living beautifully. There is no point in saying, oh, well, I protected myself. Nothing happened to me. Fantastic. Look, I've arrived at death. And wasn't that interesting? No, it wasn't interesting. What's important is that you navigate the waves. You enjoy the sea. You enjoy the air. You enjoy the difficulties. You enjoy the storms. You enjoy the sun. Actually, that's what makes life worth living.
Can I come in, Nimish bhai?
Absolutely.
Nimish bhai, can I come in? Nimish bhai? I think what Ameet bhai said is absolutely right. I think we are going to live with this virus for next 2 years, maybe longer. We are coming down on lockdown happened. The curve is flattened, is not end. We have to learn to live with it and do what that virus demands to keep us protected. And one thing, I think two things very positive out of this coming out is scientists like Shanaya and Amit and scientists all over the world are working together to find the solution. You see the vaccine coming up, which takes about 10 years, going to happen in 6 to 7 months. So that's the speed with which people are working to find the solution. I'm not saying that's the solution, but they're working towards it. And I'm sure we'll be able to tackle the virus positively as we go along, because tomorrow may not be the same, and there'll be more solutions for how we manage the virus. And the third important thing, which I really want to emphasize, and Amit made that point, we have to learn to live with telephone consultation. Today, I've been told that double my list from 8 to 16 to see the patient and triage them on the telephone. And if only there's a doubt about this, and as Shanay said, the medical, 30% of medicine we know. And on the phone, you can triage and decide and then select out who needs to be seen by face-to-face. So as to my JITO family and all of us, it is us now to prepare ourselves. How do I consult with my doctor on the telephone to give him the best possible information so that he can make best possible judgment? Because sometimes language is an issue, and it may be that we have to rehearse that to prepare ourselves to give a best shot so that doctor can make a diagnosis. Because in 75% of the cases, diagnosis is made by taking good history. And I think Shanay is absolutely right. Medicine has not changed much about than that. And I think I will urge that our family does that and get ready with this sort of advice, preparation to consulting with your doctor. Thank you.
I think one of the things, Nimish, if I could just add to it, is that resilience and compassion towards self and others, right now is very important, but also to maintain it over the course of the, 12 to 18 months or whatever it's going to be. Again, it's very uncertain. Everybody has something that brings them some kind of peace and mindfulness in a sense. Now, we all have our own sources of resilience. A lot of people, especially when we come from India, we have faith, faith holds us, and we think, well, there's something called destiny, and people say, well, things happen for a reason. And sometimes that is also enough. And sometimes we do have to trust whatever we trust in order to feel better about the situation. You must have heard the phrase dancing in the rain. It is about not getting overwhelmed, but embracing the situation, holding on to that one umbrella that makes you feel better, whether it is your faith, whether it's your family, whether it is your work, whether it is anything. You have to find that one thing that helps you float.
No, I absolutely agree with you. And in fact, it's very interesting. I was listening to a short meditation by somebody called Sadhguru on the YouTube this morning. And it actually said that faith helps you get to places where a thinking person may not get to, because a thinking person is thinking too hard. Whereas the person with faith is stop the thinking and is just acting. So you're right, in that sense, absolutely. We have a good heritage to see us through this. There are a few technical questions come up on the chat. I don't know if you can see those. If any of you can see them, would anyone like to pick them up? Something called the Kubler-Ross curve of change. I have no idea what that is.
I can talk about that if you want.
Yeah, very, very briefly, because
it's addressed to you.
We're already 90 minutes, and I want to spend another 2 or 3 minutes. And then, Amit, if you want to give some takeaway messages,
Sure.
then Arvind Bhai, and then Shanaya. Yeah.
So they're talking about the grief cycle, which is the Kubler-Ross grief cycle. And, you know, when we experience grief through loss, we all go through phases that are pretty much similar, although they may occur in the same order or different orders, or mixed for some people. A lot of people, they feel denial to begin with. You just imagine yourselves in a scenario where you've lost something really special to you. And, you know, you suddenly, first reaction would be, no, that's just not possible, you know. So that's the denial. And then slowly people move on to other phases like anger. You know, I must have done something wrong, or you must have done something wrong. Who can I blame for this? Slowly this anger resolves into a different emotion, sadness. And sometimes anger and sadness go together. And people remain a bit sad, tearful, you know, about their loss. They start bargaining, you know, sometimes when we go to temples, etc., we would say, okay, God, if you would do this, I would do this for you, that kind of bargaining. And then slowly people come to a phase where in order to get out of their cycle, they have to accept. At the end of the day, we have to accept, because radical acceptance is the only way to move forward. And when they reach that acceptance or adjustment phase, they are back to their normal lives. So that's what I suppose the grief cycle is.
Okay. Arvind Bhai, would you like to say a few things about a takeaway, and then Amit?
Okay, thank you. Just to reassure is children get very mild symptoms with COVID. But my concern is the non-COVID element of illness, which we said, the collateral part. So if your child is unwell, it is more likely to be non-COVID. Hospitals are safe places to go. So do not delay taking your child to the hospital. Hospitals are safe. Number two, which is Ameet Bhai asked about, is do ask for risk assessment if you're in frontline job, especially South India. You know, we come from South India, southern part of South Asia. So risk assessment crucial to you to protect against virus. And I will send you the link. I will send you the link.
Thank you very much.
I saw that that point. And I think third thing is, as mentioned, I'm sorry, I'm going a little bit over on that. We have started the free telephone line. If people want to have a chat and support, we will be happy to if Nimesh Bhai and Kiran are happy about that, to share. And they can call that number and we can signpost you what to do and advise you support.
Okay, thank you for that. There is a question on masks, Amit. So in your takeaway points, maybe you could just touch on the mask thing.
Yeah, so it's very important that let me start by saying that you've seen a lot of certainty and a lot of uncertainty, and that sort of information is so overwhelming. Okay, in terms of masks, you know, I've asked you a question. Do you believe you're a person that can easily get through a chest infection or not? If not, because you're vulnerable, because you have diabetes, because you have high blood pressure, because you have heart disease, because you have lung disease, because you have asthma, perhaps you're pregnant, less than 28 weeks, perhaps you're overweight, These are all of the things that within the risk assessment are the things that will predict that you will not be able to easily navigate through COVID-19 without needing a ventilator. So those are the things that predict you're going to end up on a ventilator. Now, if you don't have any of those risk factors, then the idea of a mask that is not actually perfect, you know, that's like shooting an elephant coming at you. And if you know you're not going to be able to get out of the way, don't shoot a little pea gun at the elephant, okay? So think bigger than masks. Think, how are my lungs? How strong are my lungs to the stress of a storm? And if you're strong, then just get on with life, okay? If you're not, then be really good about protecting yourself and actually making yourself stronger. So I'll come to my 3 take-home points, if that's okay, Nimish.
Please.
Number one is slow down, okay? Just take your time with everything. Take the moment to understand what is it that's making you afraid? What is it that's making you paralyzed? What makes you uncertain? It doesn't have to hold you. You are stronger than any negative emotions. So slow down, move on. Number 2, please understand that the media and the publicity is focused on all of the uncertainties and negativity. Very few bits of the media talk about the millions of people that have safely recovered from COVID-19, that are safely back to normal lives, near normal lives. That is what's really important. It's not about the new normal being abnormal. It's about getting back to the things that matter to us, shaking hands, hugging, being with people, loving each other, having, playing tennis, going swimming. That's what it's about. If we have to have technology catching up with us and medicine catching up, well, that's what we demand and that's what we help. We support each other to come together with funds, to come together with your time, to come together in clinical trials and research. Bring it all on. Make us the best possible people we can to be resilient to anything that takes away our positives of what life's about. The last thing is just personalize every choice you make with what you value. We are Jains. Jains value, number 1, the lack of non-violence, the lack of harm to yourself, lack of harm to your loved ones, lack of harm to your family, lack of harm to the people that are trying to distract me in my room, such as my 18-year-old daughter, okay? These kids are kind of like in the background now, and we've arrived at a new place of working where I can be at home and my kids can be mucking around in the background, and that's okay. And I'm in a business meeting, I'm in a research meeting, or I'm doing a patient consult. That is a great place to be. So as Jains, remembering we're interconnected, remembering what I personally want to choose to be, which is be a positive individual with no harm. Keep that focus in everything you do. Just enjoy anything that hits you, and that which does not kill you makes you stronger. Believe it, know it, live it. Thanks very much.
Okay. Shanay, would you like to say anything from a mental aspect?
Yeah, I would really echo points, be mindful, live in the moment and make the most of it. We look back and we think, oh, could I have those days? Actually, some of these moments are precious, value them. Be kind, be compassionate to yourself first, and then to people around you. And as Amit says, yes, there's a lot of media hype about a lot of things, but use your own judgment. Is it for you? Is it important for you? But how can I actually contribute to the community and help others so that we can all, as a human race, navigate through this problem?
Great. Thank you very much, all 3 of you. I think the take-homes about positivity and living in the moment and considering what's important to you, that has actually come through. If you think of all the neighborhood groups which have happened, the show of appreciation to the key workers, to people running around with baskets of food, to hospital workers, letting them into supermarkets first so that they can be well nourished so that the rest of us are looked after. And in many ways, of course, a lot of people have responded positively. Equally, of course, there'll be people who are still afraid. And I think from the comments we can see on the chat, some people have been reassured. there are some very specific questions, which I think perhaps is not the time to answer, because I want to leave everybody with a very positive message. You had heard a professor of mental health give you be in the moment, which our heritage has been saying forever. You heard a cardiologist tell you, be in the moment, value what's important to you. It's just amazing. So I want to thank all our speakers. Thank you very much. Arvind Bhai, thank you very much for reassuring us that children need to go to school. Okay, very important. And university, of course. So the 18-year-old Amit, she won't be there soon. So,
well, no, she'll be doing university from home, right?
well, let's see. But thank you all very much. I think people have some very good comments. We had a good turnout, so I hope that we've reached a good number of people. I would like to ask Manojji, please, if you're here, Manojji, please, would you like to come in now and just give a vote of thanks and talk about the next JITO event?
Thank you, Ramesh Bhai. Jai Jinendra, everyone. I'll be very brief in the interest of time. What an amazing group of panelists and what an amazing discussion. So I would thank on the behalf of all the audience and all the comments I'm getting through the chats as well as some personal messages to Dr. Bakhai, Professor Rathod, and Dr. Shah. And other thing I'll say is, being a trade organization, we were quite skeptical, to begin with, what will be the appetite amongst people for us to hold a health-based program, and how wrong were we? So we are really encouraged with the level of engagement that we have seen with this program and the interest evinced through the comment box. So we are planning to have a webinar of this nature every fortnight or so. So watch the space. We will have another one, something on the health in very near future. And I also will thank every member of audience who are here, 1 hour, 40 minutes later, still here. And some of you are, patrons of JITO UK. And I particularly thank you for being here this evening. And with that, thank you once again, everyone. And how can I forget thanking Ramesh Bhai and rest of JITO UK team for organizing such a beautiful meeting. Thank you. Good night. Jai Jinendra.
Jai Jinendra. Thank you.
Jai Jinendra, everybody. There will be a recording of this going onto the JITO website, and the speakers, we will also be sending you a copy of the recording for your own records as well. So thank you all very much.
Thank you.
Thank you.
Thank you, Ramesh. Thank you,
Thank you.
Shanay, Arvind.
Thank you, Arvind.
Bye, guys.
Thank you.
Thank you so much.